smiling awfully hard.
I always smile when we talk about good things like this.
I know, right? So the second week of November is National Nurse Practitioner Week.
And today, Dr. Kevin Scalf joins us to tell us more about psychiatric mental nurse practitioners and what kind of care they provide to kind of open our eyes to all the possible scenarios.
Sure.
We are so glad to see you. Thank you for being here.
Thank you for having me. Thank you.
Yeah. All right, let's talk about, first of all, what are the current needs in the mental health community as far as that's concerned?
Sure. So right now in our country, 1 in 5 adults and 1 in 6 youth experience some type of mental health problem in the country. And a lot of these problems stem from anxiety, depression, substance abuse, trauma, so forth. And so it's a huge need all across the state. There's a shortage of mental health providers as well. And we also see that the suicide rate is increasing. Right now in our country, a suicide happens approximately every 11 minutes. And so that's really staggering if you really stop and think about that. And as far as youth go, suicide is the second leading cause. Suicide is the second leading thing what we see in young people, age 12 to 17.
So how are nurse practitioners trying to combat those numbers?
So we are trying to increase access first and foremost. Studies have shown that the care of the community, the mental health of the community really improves when nurse practitioners are able to function at the scope of their full practice. And so we see those outcomes, and so we want to increase access to care, especially in rural and underserved areas. We also provide more affordable care on average than some of the other specialties, and so that in and of itself increases access to care. And we're also grounded heavily in health promotion, disease prevention. Not only can we assess, diagnose, and treat mental health problems, but we also work to prevent things from happening as well. So we really take a holistic view of the entire person.
So I do have a question. I know that you all are constantly pouring into other people. Now I know this may be a little bit of a personal question, but how are you pouring into yourself?
Well, self-care is very important, right? We have to take care of ourselves first, because if we don't, we're not going to be able to function fully and be what we need to be for the patients. We want to stay engaged, we want to have support of each other, and I always say everyone can benefit from a therapy session every now and then.
Yes,
right? Nothing wrong with that at all.
So
self-care is huge, and we have to be able to do that first and foremost.
And if someone's looking for this kind of path, for this career, they've got options with y'all, don't they?
Sure, yes, of course. People who are searching as a career path to be a psych mental health nurse practitioner, yes, there's a career path there. Most psych NPs have either a master's degree or a doctorate degree, so they have the advanced education to actually provide care and needed services for people who struggle with mental health problems.
Okay, so if we're looking for more information, how can we find you all?
So you can do a simple Google search of mental health providers in your community. You can also ask your primary care provider for a referral, or also reach out to your insurance company so that they can give you a list of psychiatric mental health nurse practitioners in your area.
What if we want you?
Well, you can look me up.
Okay.
Just
All right.
Perfect.
Perfect. Thank you so much.
Thank you for having me.